Hey, Dr. Stoker.
Hi, Quinn.
Let's chat
What's
about
up?
this patient. I feel like she had a transformative result, and I'm curious, what did you end up doing on her?
She is a great one. I was excited for her when she walked in the office, and frankly, it turned out even better than I was hoping for with just one shot at it. And we do get asked about it a lot, so I'm happy to elaborate. She's about 52 years old, and what I saw is first that she had significant jowls and neck laxity. It was very important in her jawline. She had a lot of changes around her eyelids, okay? She had bags and wrinkles underneath her eyes. She had some hooding of the upper eyes. And the texture of her skin overall appeared much older than on a younger person. What we did is our Traceless deep plane face and neck lift. You hear a lot of that these days, right? It's very powerful at rejuvenating. The second thing we did is upper eyelid surgery. That was really key for getting the light into her eyes. So you can see that instead of looking like beady, dark eyes, they are glistening brown eyes. And then lastly, we did fractional carbon dioxide laser resurfacing. And that was really important in this case. We did it at a deeper level than I would normally do because I thought she could benefit from it. There is a longer recovery when you do that, but you can see the impact it had on her here. Her skin looks extraordinary.
Yeah.
Zoom in on the brow and check that out. Look at under her eyes. I mean, I didn't do lower eyelid surgery on her. I did fractional carbon dioxide laser alone. That's really impactful. Look at the texture around her mouth, the texture on her chin, all of it looks many decades younger than what she started with.
Sure. She looks amazing.
So let's talk a little bit more about the deep plane technique, because that's kind of the anchor procedure here.
Okay.
And what it means is instead of just lifting the skin and pulling it back as we would do on a face and neck lift, we lift the skin off of the deep tissues, and then we dive down into a deeper plane and free up what we call these retaining ligaments that secure all of the soft tissues of the face to the bone. And once we free those, we're really able to mobilize both superiorly towards the sky and back a little bit in just the right amount, all of the tissues. So it isn't just pulling really hard on the skin. It's going to do it. You've seen that windblown look,
Yes.
right? Not in our office,
No.
but other places. So when you take all of that tension off of the deep plane, when we lift and elevate the skin and secure it, it's not going to be under nearly as much tension. So I can get a better looking scar, hence the Traceless name, and you're not going to see streaks like you can in somebody who has that kind of windblown appearance. So that's really key. It also is key in lifting these heavy tissues all the way out here close to the chin in what we call the jowl region. So the upper eyelids on her, that's really important because when we look each other in the eye, which we often do, we think, well, what is that person happy? Are they sad? Are they older than me? Are they younger? And we do that subconsciously. In this case, she has kind of beady appearing eyes beforehand because there's no light getting in there. When we lift that skin off and the soft tissues just deep to that skin, it allows the light to get into those eyes and bounce around in the iris and sparkle like a jewel at a jewelry store. And that's really important to, I think, make her eyes light up here. The last thing we did is a fractional carbon dioxide laser resurfacing. That's a favorite tool of mine to enhance our facelift results, especially on patients with lighter skin. And there is downtime with that, but they have downtime anyway when we're doing significant facial rejuvenation. So I went a little deeper in her case because she was able to tolerate that kind of recovery, and I knew she could benefit from it. She got better value in that way. But what it did is it eliminated the sunspots that she's got. I mean, look at her, below her eyes and on her left brow there, those sunspots are gone afterwards.
I agree. I think she is probably over the moon happy. I feel like she looks 15 years younger, which would make me so happy.
Well, speaking of that, let's wrap it up here then. This is a really nice case, and I'd just like to say thank you for watching. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles, with my physician assistant, Quinn Luster, here to talk about some of our favorite cases from our photo gallery on drstoker.com. If you are interested in facial rejuvenation, check out our website, drstoker.com. We've got over 10,000 beautiful before and after pictures on there for you to review. Also, check us out on our social media. We're active on Instagram, TikTok, and Facebook. And on our YouTube channel, we've got over 1,100 videos so far. Make sure you send us your contact information with your email or your cell phone, or simply email us directly at info@drstoker.com. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles.